Wearable tech is everywhere these days. Smartwatches, VR headsets, truly wireless earbuds, fitness trackers. It's become fashionable to wear a heart rate monitor. Now that we have the capability to fit more and more functionality into a smaller form factor, there's so many possibilities in the realm of assistive devices. Wearables let you hit all the high points: cost-effective, portable, and bonus if it looks really cool. One area where wearables can really shine is speech tools for people with disabilities. People use assistive devices to speak for a variety of reasons. Some people have a tracheostomy, a tube inserted into the windpipe for direct airflow to the lungs, which makes speech difficult because the air bypasses the vocal cords. What are some ways you could hold a conversation if your vocal cords can't be used to speak out loud? Maybe you could write on a notepad or type and use text-to-speech. But what if you don't have full range of motion in your hands, arms, or upper body in general? There are several types of devices that can help a person get their thoughts out. One example is an eye gaze tracker. An eye gaze tracker is good for someone who doesn't have range of motion in their neck or below. This system lets you interact with the computer by directing your gaze. One testimonial from the Eye Gaze Inc. website says, "My arms and hands were deteriorating quite rapidly, meaning I couldn't work anymore. The eye gaze saved my software engineering job. I can control a Mac and do everything with my eye that I used to do with my hands." Their software, iWorld 3, lets you do anything that can be done with a computer mouse using just your eyes, and integrates into smartphones as well as Alexa. Their iGaze Edge tablet takes these features on the go. The user can speak with this tablet by using their gaze to type a message, which is then read out loud. The gaze tracking is done by a camera that's built into the tablet. In this case, the user doesn't wear anything on their body. Another way to speak is with a laser pointer and communication board. The show Speechless, which ran on ABC from 2016 to 2019, starred Micah Fowler as the lead, JJ. Micah Fowler has cerebral palsy, and in the show, he portrays JJ using a laser pointer affixed to a pair of glasses and a communication board to speak. These are just a few examples, but they all fall under the category of AAC. AAC stands for Augmentative and Alternative Communication. AAC can be high or low tech. The Cincinnati Children's Hospital's Perlman Center defines AAC as a way for an individual to communicate when they do not have the physical ability to use verbal speech or writing. There are so many cases for this, and the best way to understand is by checking out some examples. Although these devices are used by children and adults, Cincinnati Children's has a video that shows a few AAC devices in action, and I'll share a link to that in the description. Each individual has unique requirements for their communication devices. It's not a one-size-fits-all thing. That's why it pays to have options. I was lucky enough to speak with an expert on this topic who studies wearable tech and has invented a brand new device that could revolutionize AAC as we know it.
I'm Hananeh Esmailbeigi. I'm a clinical associate professor at the University of Illinois at Chicago in the Department of Bioengineering. And I'm also the co-founder and CEO of HCI Wearables Innovation. And our work is dedicated to developing wearable devices that are discreet, do not attract unwanted attention, and could be used as assistive devices and also as human augmentation devices.
So could you tell me the story of the HCI Retainer that you designed, a little bit about what inspired the project, and how long ago you started working to solve this problem?
Of course. When I was a student and I was doing my PhD, I was passionate about learning how the brain works in order to be able to utilize the functionality of the brain and help individuals with disability. So my prior work during my PhD, working with Dr. Patrick Rocher, was dedicated to developing auditory brain implants. And that work was fascinating and very interesting, and my future job experience after my PhD and postdoc was dedicated to that line of work. But I wanted to see the effect of the work that we do come to life faster. So when I actually took a faculty position and wanted to start my own research lab, I wanted to develop assistive devices that are still quite as smart, like the ones that interact with the brain, but they can actually be utilized faster and come to the market faster. So what we developed, we're like, okay, the next best location for a muscle that you can use in order to interact with external devices when your arms are not functional is the tongue. And the tongue is a very powerful muscle, usually doesn't get tired, and it retains some of its functionality due to all of its functionality, usually when a spinal cord injury patient is involved or when there are various different neurological patients involved, it retains some of its functionality. So we wanted to develop a wearable device that you could use your tongue to swipe on the same way you use your finger to swipe on a touch screen to connect and communicate with modern technology. So at that time, we were lucky because the advances in sensors due to cell phone, basically cell phones, smart cell phones becoming more accessible and the technology for that becoming more and more modern was revolutionizing the sensor world. So we managed to utilize some of that technology and develop basically smart oral wearable devices that you can just pop into the mouth and swipe your tongue on it as thin as possible, essentially. And so we took advantage of that technology. We managed to make them wireless so that patients could take advantage of it. We started this work about 5 years ago. The initial steps of the work happened, but over the generation of the work that happened, we managed to adapt the technology better and better to the humid environment of the mouth because it's very different, right? Imagine when you're on a rainy day when you're walking and you have water droplets on your cell phone screen, it's really hard to interact with your cell phone. So think of that problem inside the humid environment of the mouth. So over
Yeah.
time, we got better and better at it.
I think that's really smart to use technology that's based on smartphone technology because that's commonplace and readily available and, relatively affordable compared to a lot of medical devices. That's really
Exactly.
neat. I would have loved to work on that project as a grad student.
Oh, for sure. Yeah, you're welcome for joining us.
So one thing I was wondering is how durable the retainer is. Can you replace any parts of it, or do you have any rough idea of how long it can last?
That is a very good question. So as you know, with these devices actually coming out to the market, you have to address all these issues, right? How long a battery charge will last, right? How durable it is. And these are what we are still in the testing process of, but we are seeing very promising results as we're addressing each issue that we encounter and move towards having it be a long-lasting battery life and durable inside the mouth. And the beauty of it is that we're trying to make the technology as cheap as possible so that it would be very easy to replace.
Cool. So one thing that I was going to ask that you kind of already addressed a little bit, but maybe you might have some of these answers. How is it currently powered, and does it get recharged, and how long can you go between charges?
Good question. So yes, it is battery powered and we have rechargeable capability for it. And right now we haven't gotten to a stage where a person uses it continuously. But when a person is interacting with it for an hour or two every day, it could last up to a week roughly.
Oh, wow. Okay. That's pretty good.
Because it's an extremely low power technology
Yeah.
that we're utilizing.
Yeah. I definitely didn't expect it to be that long.
But
Um,
obviously things could change, right? As we start
right.
utilizing it like for 24 hours, you're wearing it all the time. So these are studies that we're still in the process of addressing.
Yeah. Is that the target you want it to be able to last a full day without recharging?
Possibly more, right? Think
Yeah.
about it, the most successful wearable tech that has been adapted were the ones that doesn't require you to charge them as much, right? I
Hmm.
mean, even when your phone gets old and you have to charge it every day or every couple of hours, that's when you know, okay, I need a new one, right?
Hmm.
So we're trying to be able to have the battery last as much as possible. And we are looking into other technology that we can utilize for powering it.
What are some of the wearables that you've studied and that kind of inspired your design?
It is a very good question. So I also teach wearable technology, so wearable technology and wearable technology laboratory course at UIC, and I teach that to basically engineering students, mainly BioE, electrical engineering, mechanical engineering, and computer science students. So they work in multidisciplinary groups and develop various different wearables, and it's a very popular class and students have a lot of fun with it. So because of that class alone and also the human augmentics class that I teach, I am constantly researching new wearable tech and learning about the technology, trying to connect with people who develop them to come and give talks, and familiarize our students with them. So it's like a never ending research project for me going on all the time.
That's really cool.
But my favorite ones are the ones that try to address disability.
So, have you had the chance to see any of your target end users trying out your device?
Unfortunately, not. No, not yet. We've done surveys with them
Okay.
and we've interviewed them, and they all expressed a lot of interest, but we haven't still tested it on on those individuals yet.
Yeah.
But we're in the process of getting to that stage actually very soon.
Yeah, I know that that takes a while to get to that point because you have to, working with human subjects is actually a big long process, so it definitely takes some work getting to that point.
Exactly, exactly.
So, what was the biggest challenge you faced coming up with this design?
The biggest challenge was being able to address the functionality of the device inside the humid environment of the mouth. That was always our biggest challenge. And trying to make the device as small as possible, as compact as possible. And trying to be able to go from custom fit to something like small, medium, and large that fits every individual. That was another interesting challenge. And throughout the way, we collaborated with a lot of dentists and designers to help us achieve this goal, and various different people who have worked in my research lab, and we brainstormed. So it has been a lot of fun. Let's put it that way.
So, up to this point, how many design iterations do you think you've gone through?
So we've had 5 main devices developed, but each one, 5 generations, but each one of them within themselves, it took various different trials and errors and changing different components, different parameters and whatnot. But let's just say 5 generations of the device so far.
That's like one per year. That's pretty good.
Yeah, cool. I didn't think about it that way.
So can you tell me a little bit about what it has been like launching a startup company?
That is also a very good question. So we started the company 2 years ago. It started with me and a PhD student who was involved in this project, Nick, from the very beginning. It has been very interesting. You constantly learn new stuff. Some days you're like, oh no, this is not such a great idea. I won't go anywhere. Some days you're like, this is the best idea. I'm going to make a difference. So it's full of learning, full of disappointment, and full of excitement, and you go through various different challenges every day. But I'm very very touched by the fact that through the COVID era, where everything became virtual, I managed to network with a lot of people from around the country and around the globe, and everyone is willing to help, and everyone is giving constructive advice to move towards the correct direction. So I've been enjoying the process a lot.
It brought me connected with you even, so.
Thank you. Yeah, and thank you for reaching out. Like where we met, the conference that we met at, had it been in person, it might have been hard for us to communicate, but the fact that it
Yeah.
was virtual allowed us to reach out to each other later. But at
Yeah.
the same time, obviously, I miss the human connection and actually
Mhm.
interacting with people. Yeah.
Yeah. So are you working on any other projects that you can and would like to share?
So within my research lab and the startup, we are interested in developing wearable tech in general. So there are a couple of really interesting projects that we're still working on too. They all have application in medical field or in assistive devices.
So where can people go to learn more about your work?
So I have a lab website and a startup website, and they could see some information there. We have a couple of papers being ready for publication right now, actually, and I'm always happy to talk to people because I've one thing I've learned is that everyone has a new insight, and even if they're just asking you a question to learn about your tech, they're looking at it with fresh eyes, and through their eyes you can see, oh, where are the areas of improvement, or how can you address an issue that you're facing? So I'm always open to talking to people.
You really are making me want to go back to school.
Oh, well, I guess as a professor, I'm doing my job.
Like most of the topics covered on this show, I'm no expert. If you or someone you know uses an AAC device, I would really like for your perspective to be shared on Modern Access. Please get in touch if you're interested. If you want to learn more about AAC, the Perlman Center at Cincinnati Children's offers some good resources on their website. They focus largely on cerebral palsy, but they show plenty of good examples and offer links about all kinds of assistive tech. If you want to learn more about Dr. Esmailbeigi's work and the Smart Retainer, check out her Wearable Technology and Sensory Enhancement Lab. Links are in the description. If you have a question, or if you know of any adaptive tech that you think should be featured in an episode, or if you just want to get in touch, email me at modernaccesspod@gmail.com, or you can leave a voice message on Anchor and it might get played on the show. The easiest way to support this show is to subscribe to Modern Access wherever you listen to podcasts. Modern Access is also on Patreon. You can join and get access to behind-the-scenes content. You can also follow Modern Access Pod on social media. Modern Access is produced and hosted by me, Coach Kaitlin. This show's theme music was written by Quentin Wolf. Graphic design for Modern Access is done by Allison Manares. Thanks to you for listening.